Hi guys, welcome to the Aging Games. I'm coming to you driving in my car with my very good friend Kay, and we're on our way for her surgery. She's gonna have blepharoplasty, upper and lower blepharoplasty done.
Hi.
And Kay is a very interesting case, and we're gonna document her whole journey. Kay's had Bell's palsy for the past 23 years, 24 years since she was pregnant with her first child. She's actually not doing the surgery for aesthetic reasons. She's going to be doing it to fix some asymmetry and to get her looking back to her old self. So she's very excited about this. And Kay, can you tell us a little bit about the Bell's palsy and how you found out about it?
I think that people in my Bell's palsy group will know all this, but it literally comes out of nowhere overnight, and it's just a paralysis of the one side of your face. And for most people, maybe 85% of people, in 3 months it corrects itself. The problem is that if your nerves don't correct like back to their original paths, you get like a skinesis, it's called. And as you can see, my face is not symmetrical, and like the nerves are incorrectly reconnected basically. So I'm doing the surgery to try and get like this eye to be the same size as the other eye, which will make a huge difference. Yeah, that's the thing with Bell's palsy. Some people get lucky and it cures quickly, and other people it takes a lifetime.
And what kind of things have you tried?
So I've done many rounds of acupuncture, which actually really helped in the beginning, and it would be worse if I didn't have the acupuncture. People doing various types of physio. I've done the electric pulse machines. I've done many stretching exercises, but really once it's set in, it's quite hard to reverse.
So you really have tried everything.
I've tried everything, so I'm quite excited about this. I think that just to have your eyes symmetrical will really make a big difference to me. You know, I'll just feel more comfortable socially, and I think it will really kind of transform my face. And in this modern era of masks, you don't really see my mouth, so hey ho.
We didn't really bank on all these tunnels when we decided we'll be filming inside the car. We forgot about all the tunnels on the way. And actually Kay is going to be going to the same surgeon who did my eyes back in July, Dr. Roberto Pizzamiglio, who is fantastic. We love him, right? Kay, are you excited? Are you scared about your surgery?
I'm really not scared because yours came out so beautifully and so well. But I'm really excited because this is like the first step that I've ever really done to do something serious that's going to change my face. So I think it'll be really exciting. And I have seen on my Bell's palsy group other women who have done theirs, and the difference is amazing. So fingers crossed.
Well, I'm super excited for you, Kay. So what we're gonna do is we're gonna document your journey. Every day we'll do an update so people can see how everything's going. And so stick with us, guys. More updates coming up soon. Kay is getting her pre-surgery photos done. We're doing the markings now for the surgery.
So I'd be interested to see how you get to balance the eyes. Because you're going to try and get the eyes the same size. This is the trick.
Will you remove some muscle and some fat from her as well? Yeah.
The fat is
In the corners, right?
in the corner, yeah, close to the nose, in this part.
Mm-hmm.
And yeah.
And for the bottom lids, are you doing like a pinch kind of lift?
Yeah, now we will remove the extra skin in both sides, and we fix the muscle at this level to tighten the eyelid.
Mm-hmm.
To try and get them the same size.
Exactly.
Do you use stitching on the bottom eyelid as well, or
Yes.
you do stitching? Okay.
Did you ever do Bell's palsy, someone with Bell's
Yes,
palsy
we
before?
got a kind of each facial pose is different, so we have to do. Now we are working only on the eyelid, and open again. Relax.
We saw that some people are having like weights put into the eyelids for Bell's palsy too. Yeah, like gold. They put like little gold things. Yeah. I also love how Dr. Roberto, he draws the corners of the upper eyes going upwards a little bit, because some surgeons just pull that straight down, and then when they remove the skin, you kind of had these sad eyes. But the way you do it with the corner going up, it really opens up the eyes. I think that makes a big difference. It looks so much better already, Kay. I love it. So Kay's on the operating table now, and she's gonna have the local anesthetic in a minute. How you feeling, Kay? You nervous?
No.
No, she's chilled as a cucumber.
Can't listen to my headphones. I told them they're going to have to tell me a lot of long stories. you know, quickly I get bored. The attention span of...
I can give you a sleeping pill.
No.
And carry you home. The needle is very small, so don't worry. This is actually the worst part, just the little pokes. After that, you won't feel anything. You want me to hold your hand?
No, thanks. Thank you for your kindness, but the day I ask you to hold my hand, you know we've got a problem.
She's a tough girl. Are you okay? Does it hurt?
A little bit.
Yeah, a little sting. You're gonna be so pretty. And you're in the best hands. It really makes such a big difference that, you know, once you see someone's work, like I did with Dr. Elena and Oksana and everyone, you see it and you see how beautiful it looks, and then it's... Do you start with the top and then do the bottom?
Yeah.
So the bottom will be a little bit more bruised, right? A little more time for recovery.
The eyelids are really delicate, so
Yeah.
the inflammation is either up and down.
I feel like I'm at the dentist.
Yeah, that's what it's like.
You can talk.
Yeah. But really, that's the best part, that you can do it in the doctor's office. You don't have to go to the hospital. You don't need IV sedation, although you can have it, right? Some people do have it with IV sedation.
Yes,
But then they need to go to the hospital. And it's just a really simple and quick procedure. Delicate, yes, of course. but for the patient itself,
And don't
it's not.
rush. I don't
Rush. I'm happy to wait. No, but relatively speaking, like we were just saying, you know, if your eyes bothered you for the past 10 years, and then in 1 hour you can, or 20 years, and then in 1 hour you can fix it, and then okay, a week recovery, but still, and then compared to the 20 years of suffering, I mean, that's pretty amazing.
And I'll try and follow your recovery protocols with the arnica and the red light therapy.
Yeah, I've got the arnica 4K, bromelain, which is also really good, and then the red light. I think the red light helps so much also with the scarring.
Yeah.
I'm still doing it every day. And then once the stitches come out, then you have a special cream that you can use for the scars to help them fade faster.
Yeah, exactly.
I'll get you hooked up with that as well. And then another option is also like you can do a laser if you wanted to heal it more quickly. You do the laser about 1 month after surgery, and then you can repeat it if you need to. Like I did it one time, and then they told me to come back one more time. The important thing is to get...
Oh shit, that's very sore.
Yeah. Sorry. The inner part is the more sensitive.
Yeah.
So how many of these have you done in your life, do you think?
How many?
Mm-hmm.
Oof. I think thousands.
Thousands, wow.
In 33 years.
I suppose you remember one, the first one, and then after that they just roll. I'll have to try some sort of meditation too.
Yeah, try that, Kay. Then the time will pass quickly. So you will do the anesthetic for the lower lid after, right? So it doesn't wear off.
No, we'll do now.
You'll do it now?
Yeah, because...
Dr. Roberto is just redoing the markings to make sure nothing gets missed. It's quite a bit of skin too that's coming off hers as well.
Does it look like a bigger piece is coming off the one eye than the other?
Yeah.
Now little injection in the lower eyelid.
Oh yeah, that's horrible.
Horrible.
Like I said, the injection's the worst part. After that, you won't feel anything. But yeah, the skin's very sensitive there.
I'm sure I've never had an injection there in my life.
Yeah. No tengo celo.
You know, I can quickly get out of my body, so...
That's the worst of it. You won't feel anything else after this. Okay.
Surgery done.
Surgery?
I don't know how long it took, like an hour, a bit longer,
About an hour and a half.
Okay.
Yeah,
An hour and a half.
Yeah. But you're looking really good,
Oh,
actually.
thank you.
How you feeling?
Yeah, it's alright.
Yeah, it's all right. It was survivable.
Survivable.
You're
yeah.
anxious to get home. Can you see okay?
Mercilessness.
Okay, fantastic. Off we go.
So about 4 hours post-surgery and I'm already feeling a little bit better. I'm just lying with a pack of peas on my eyes because they just kind of nestle nicely into the crevices and give me a lot of relief, and I can also see a little bit better. So let's see what day 2, which will be tomorrow, brings. So day 2, slept quite well. I really propped myself up, so I was almost sleeping upright all night. Not much pain today, which is great. As expected, my eyes are quite swollen. I suppose the bruising will come later, not too bruised. I gave my eyes a little clean with saline solution this morning just so that I can get the sleep out, which really helped. And I've been making best friends with a bag of peas. I do about 15 minutes every hour just sitting with peas on my eyes, just doing cold therapy. So day 3, working on my eyes seem actually a lot more swollen than yesterday, and I had a lot of sleep in my eyes, so I've had to rinse it 3 or 4 times with saline solution before I could even get them open. I've also already done ice this morning, and I've done a little bit of infrared lamp, and I'll just keep on going with ice and infrared lamp all day. If you look closely, I don't know, you can't really see much change yet, but tomorrow I'm going to the doctor to have a bandage change, and then I think you'll really be able to see what's going on. Lucky for me, today's Sunday, so it's just a pajama day. So day 4 is dawned. I've been to the doctor, I've had the dressing changed, and I think it's all coming along really nicely. I'm keeping up with the ice, I'm keeping up with the infrared, and this time next week I'll have the stitches out. So all is going in the right direction, which is great. So day 6, and I can really see fabulous improvement. I mean, there's still quite a lot of swelling, much less bruising on my under eye than I was expecting. And the beautiful thing is when I smile, my eye doesn't close. And with Bell's palsy, whenever I used to smile, my eye used to close. So I'm very happy. Let's see what the next few days bring, and then Monday next week, stitches out. So happy days.
Hi guys, we're on our way to the doctor. And Shona's here in the back. Say hi, Shona. Hello. You guys will see Shona soon in another video. And Kay is having her stitches out. It's today, what, day 10? About day 10. Her eyes are looking amazing and she's feeling really good. We are so surprised. She has like 0 bruising underneath the eyes. Do a little close-up, Kay, so they can see how good your eyes look.
So you can see this little bit of plaster. I didn't want to take that off, and there's the stitches that are going to come out. We're on our way to have the stitches out now. So
how are you feeling, Kay? How was the whole journey?
I mean, really, it was really easy. It has really not been very painful, and I mean, the swelling just goes down every day. Everything looks a little bit better. So it's been a really easy journey, truthfully. Who's to think?
You look really good, and we'll film the stitches coming out.
Happy days.
So we're here with Dr. Roberto Pizzamiglio in Marbella, and Kay is getting her stitches out today. Don't worry, Kay, it doesn't hurt. It's gonna feel so good right away, like all the tension and everything is gone.
So yeah, that eye seems more swollen than the other one.
Yeah, it's quite a bit more swollen. And you don't sleep on that side, you slept on your back the whole time,
I slept on the back.
You're such a good girl. I was sleeping right on the side from the day 1. The bottom of her eyes look so amazing, and they didn't swell or nothing.
Yeah, that's true. It's good.
And I wish I would have done mine
Good
too.
post-op.
Yeah, after I saw my friend, it was a few years ago, and hers just looked so, she couldn't even leave the house. She looked like she'd been punched. I thought that
Black
was
and
coming
blue,
to me,
yeah.
and look how nice mine is. I mean, I've been going to work, no one even notices.
Good quality patient.
Yeah. Good doctor. But normally, is there bruising underneath?
Well, it's very subjective. Sometimes yes, sometimes no. Depends.
I also think, you know, a lot of ice, a lot of infrared, arnica.
Depends of the kind of technique or problem the patient has.
From the bottom, did you remove any fat or any? You did.
Okay, yeah.
And even that. I thought perhaps there wasn't any removed. Maybe that's why.
I didn't want to look, so I can't really tell you.
Done.
Wow. You need good eyes and steady hands. Wow. It's going to look so good, Kay. Hi, Kay. So you've had your stitches out, and we're back from the doctor. How are you feeling?
Amazing. I mean, it really wasn't painful having the stitches out. It's been really easy. And you can see, I mean, there's a little bit of healing still going on. And then obviously the swelling, I think in the next 2 or 3 weeks, the swelling will go down and I'll be looking like the goddess.
You will be for sure, and you're looking amazing. And thank you so much for sharing your journey with us. And if you guys enjoyed this, please don't forget to like and subscribe. Say bye, Kay.
Bye.
Bye.